Let's take a moment and look at the Super 6 checklist tool. You can find it easily linked here and on the slide in front of you. This is a small tool. It's very easy to hold in your hand. And it has 6 quick things to remember around issues to consider for advanced care planning. And it looks like this. It has 2 sides. The first side has the questions and reads, what's important to you for your dental care? How much should I budget for dental care now and in the future? And again, the budgeting question is going to be quite important. Do I have insurance for dental care? And if so, what does it cover? So all kinds of dental care may have partial coverage or coverage for some types of treatments but not others. So it's really important for you to get a good understanding about how fulsome the coverage is. Who else knows about the dental insurance information? So if you were to become incapable for some other reason, how likely is it that someone would know how to find your dental information or indeed your dental insurance information? Who else knows who my dentist is? What we know is, very often, the dentist is not well known outside of the one person who is the patient. And then, does my personal care substitute decision maker know what I would want if I was no longer able to make the dental decisions myself? So we know that the ability to speak is affected by good oral health and dental care, or indeed bad oral health and dental care. Pain is an important issue to consider, but also the types of foods we eat are critical when it comes to the type of oral needs we may have. And appearance may be very important. So, who else knows what your values, wishes, and beliefs are around that? On the back, and you'll be able to see this as well on the document you're looking at, is an easy place for you to fill in many of those answers. You can keep this on the fridge. You can keep this with your other planning documents like your wills or your taxes. You can make a photocopy or a scan. You can even fold it up and put it in your portfolio and carry it with you. It provides a place for you to put your substitute decision maker's name as well. You can also see that we have a toolbook called the Wishful Thinking Toolbook. And this toolbook can be filled out in one go, or indeed it could be used as part of an ongoing conversation that you may have with somebody else. And this toolbook, which you can easily hyperlink here, in large font allows you to ask the important questions to get you thinking about what you would want, or to start a conversation with a client, a patient, a relative, and a friend. And it follows along as follows. The first letter is W in the wishful. And it really starts the conversation around, what are you worried about? Is it a specific tooth? Are you worried about hot and cold? Do you have anxieties or fears around going to the dentist or dental surgery? Who can take you to the dentist? So this is an opportunity for you to consider what those are and provide some suggestions so that you can either start a review of that or have your own conversation. So what's ideal? It's important that we not just talk about what we're worried about, but what do we like and what do we wish? So what's the best possible scenario for you as you grow, for your teeth as you age? What would be the best possible outcome? How often would you come and to which dentist? What would you like to look like? And what are your specific quality of life issues that you consider ideal that involve your mouth? S is for strengths. Again, looking at the positive piece. What do you bring to the table? What's good about you and your situation when it comes to your oral health? Or indeed, about your situation. You may be very well supported by somebody who has a good understanding of oral health, and your teeth may be in good shape. Those are 2 strengths. Your teeth are in good shape, but you also have the strength of being very well supported. Happy. H. If we were checking in 6 months or 9 months or a year, what would be progress and what would be the things that you would like to maintain or improve? The last 3 letters are really about the advanced care planning and the legal aspects that we've been talking about. So F stands for financial. This is often a more difficult one for people to have a conversation around, and it may require getting a little bit of paperwork photocopied, scanned, or referenced to fill out the workbook. So you may need to consider, have you been putting money aside for a dentist for future need? Many people will say no. In fact, I don't think I've ever met many that said yes. But it's an important thing to consider. And what insurance do you have? Can we get a copy of that insurance and attach it to this workbook? And where are those documents? If you don't attach it, can you write a note about where they're being kept so that somebody else can find them if they need to? It's important to find out whether or not, do you take care of your own finances? Does somebody else take care of your finances, your spouse or friend? Or is there somebody else who is kind of running the money for you? So a conversation, who pays the bills and why? Is it you or is it somebody else? And if it's somebody else, how do we get in contact with them? One of the questions is, how much do you prioritize your teeth? Some people don't care as much as others. Some people care an awful lot. In some areas, you may qualify for some free or low-cost programs. So an opportunity arises here in the workbook to do a bit of looking around, and you'll see some references to some programs in Ontario, but there are similar programs in other parts of the country. Very often, however, we see people who may be quite low income who are not able to easily afford the dental care they need. And there can be some real and significant challenges in that. U stands for understand and appreciate. If you cast your mind back to the nexus, that chart of 4 squares, capable, you decide, incapable, someone else decides, the substitute decision maker, that's really about consent. Who gets to consent? To consent, you need to be able to fully understand the question that's being asked of you. And that means you have to understand and appreciate both the issue at hand and the consequences or outcomes. Now, you, as a perfectly capable adult of any age, can make a foolish decision if you want. You're perfectly allowed to make a, quote, bad decision, or an abstruse decision, or a contrary decision. As long as you are able to understand and appreciate that, that's fine. But if you are incapable, or there's real questions about the outcomes, we may need somebody else to support you in that decision, or have a substitute decision maker if you are unable to understand and appreciate. Really, the most important thing is this. We always assume capacity. It doesn't matter what the person looks like. It doesn't matter the age of the person. It does not matter how well they communicate, as long as they are able to communicate in whatever way they are able to. L is for law. And we've been talking about that a little bit in terms of who gets to decide. But some of the questions are this. Do I have an up-to-date power of attorney for personal care or for property or for both? Now, they're not required, but it certainly can be very advisable. If I don't have a power of attorney, who's my substitute decision maker for personal and health care? Remembering that there won't be one for finance. Does my dentist know what my documents say? Or does my dentist know who to contact? This isn't an emergency contact, this is a substitute decision-making contact. You'll see here as well that we've listed some further practical resources. What's the take-home message here? We know that dental elder abuse and neglect is rampant in Canada. We've looked at the statistics around older adults' need for restorative care, so that means things like fillings and taking care of cavities and restoring the tooth and the mouth. We know that it's very, very high. We know that in long-term care and congregate care, the statistics are very high as well. And we know that the issue of dental has not really permeated the elder abuse and neglect dialogue. We hope that these tools, the Super 6 tool, the wishful thinking tool, and this webinar can be part of your toolbox to help support older adults and prevent elder abuse and neglect. Thank you.